The Intensive Community Treatment Team, or ICT, provides services to adults with serious mental illness in Chesterfield County. This interdisciplinary team is made up of a psychiatrist, psychiatric nurses, an administrative team, peer specialist, a substance use specialist, a vocational specialist, clinical therapist, and a team leader to pull it together and triage needs throughout the day. The entire staff of highly skilled clinicians meets daily to review all cases in the program and determine the best course of action for everyone being served. Most individuals receiving services have a diagnosis of schizophrenia, schizoaffective disorder, or bipolar disorder, and have a history of psychotic symptoms not easily managed with traditional treatment. While this program model is an evidence-based practice accustomed to providing non-traditional mental health services, COVID-19 has proved to challenge the already challenging service provision. However, the team rallied and has come up with ways to continue programming through use of technology, as well as brainstorming on a case-by-case basis how best to serve these individuals.
The technology has been helpful overall to keep communicating with the team on a real-time basis. So we are able to, if something comes up, a crisis or a situation that needs to be taken care of, we can immediately communicate with each other in real time and not have to delay the process.
We started using it a touch before the pandemic started, so it just was like, okay, well now we just got to do conference calls in the morning, and it worked for that. So I like Teams a lot.
I think the technology has been so useful that it's going to change the way we do things down the road. Like, it's been very helpful.
I don't know how we would have gotten through this period without it, really. I mean, I felt a little internal resistance initially, but it's really grown on me, and it's been a great tool for our team to continue to function almost without any bumps in the road.
I think just overall, it's better communication. That's just the bottom line. That information can be shared faster than it would be if it's just email or, texting.
For the clients, if we're able to do work with them electronically in their safe space rather than having to take them someplace, health and safety issue at this point, to have technology and to have it working appropriately at this point, to really be able to, effectively communicate and to meet the needs of our clients.
I think SharePoint is fantastic. Be able to quickly access on your mobile device or your laptop a wealth of information about our clients that we need when we're in the field or away from the office, or we can't log on to the electronic record. There's all that right in your hand. It's just fabulous.
Definitely helps when you're at the pharmacy. It saved me many, many times. And I like the fact that a lot of things don't get forgotten, because if a client has something that they want us to relate to the team, we can just get right on there and put it in Teams, and there's not a lag in time as far as, getting that information out.
You know what I love in SharePoint, when you pull up the client information and go to their address? I love hitting that hyperlink and it pulls up Google Maps. It is so easy to go from place to place out in the field. That's fantastic.
Right. It was one of the clients needed an injection, and he was at 3 possible locations. He could have been at his home, or he could have been at his mother's house or his uncle's house. And the house was out in the country. I was able to, communicate with other team members on using Teams, and the response was immediate. And then it turns out that the uncle who lived in the country, the geographic location was texted to me, and I could set it up with directions, and it took me right to the location. Amazing. So really very helpful.
Through Teams, we find out he's stressed out and heading to the hospital, and everybody is alerted at the same time, and communication, make sure he gets all his medication, and he's being discharged, and just the fact that it's not just one person dealing with it, it's a team dealing with it, and I think that makes a difference. I mean, when we feel like we're not alone, dealing with it, we can just quickly put a message on there, and then everybody or whoever's available can respond, and it's a team effort and not just that individual by himself.
Thank you for watching these highlights of the Intensive Community Treatment Team. Keep an eye out for more videos and highlights tomorrow about our team. We are proud of the work we do, and we want you all to know how hard we work to serve the community. Thanks for watching. See you tomorrow.